Hi everyone. Today I'm going to talk about anti-diabetic drugs and I'm going to tell you what is the common mistake done by the students in exams also. So before learning about anti-diabetic drugs, I'll give you a little bit introduction about the diabetes. Diabetes mellitus, it is a heterogeneous chronic metabolic disorder which is characterized by the persistent hyperglycemia which resulting from the defects in insulin secretion and or insulin action. What are the clinical features of diabetes? We all know they are mainly characterized by hyperglycemia, then glycosuria, hyperlipidemia, negative nitrogen balance, sometimes ketonemia and ketonuria. Prevalence of the diabetes all over the world is too high and it is not even lesser in India. So India's prevalence is almost equal to that of the global prevalence. So early diagnosis and treatment help in preventing macrovascular as well as microvascular complications. Coming to the classification of diabetes mellitus, we have mainly four types, like type 1, which is mainly due to autoimmune cause where the beta cell destruction occurs, so which may result in absolute insulin deficiency. In type 2, which is characterized mainly by insulin resistance. Other specific types of diabetes which include monogenic diabetic syndromes like neonatal diabetes, MODY, LADA, and disease of the exocrine pancreas, which includes cystic fibrosis and pancreatitis. And sometimes even the drugs and chemical will result. Prolonged use of drugs can also lead to diabetes, like glucocorticoid use or treatment with the HIV drugs, which are used in the treatment of HIV and AIDS. Okay, another type 4 is a gestational diabetes mellitus. So mainly pharmacotherapy, if look at what are the drugs or medications available for treating diabetes mellitus. Mainly we can classify them as under two categories, that is insulin preparations and oral anti-diabetic drugs. As we look at the classification in type 1, mainly what is the reason? It is a absolute insulin deficiency. So for treating type 1 diabetes, we have a drug that is only insulin preparations. So these oral anti-diabetic drugs are mainly used for treating type 2 diabetes. Coming to the insulin preparations, what are the available insulin preparations which are used in the treatment of type 1 diabetes as well as gestational diabetes as well as type 2, which is not controlled with the oral anti-diabetic drugs. So we have, and even in diabetic ketoacidosis, we use insulin preparations. There are many uses of insulin preparations, but for treating type 1, right now we have insulin preparations. These are the only drugs which are used for treating type 1 diabetes. For treating type 1 diabetes, we don't have any oral medications. Okay, if we classify insulin preparations as rapidly acting insulins, short acting insulins, and intermediate acting insulins, as well as long acting insulins. This is the classification is based on duration of action of insulin. Okay, rapid acting insulin, they are insulin lispro, aspart, insulin glulicin. There are three rapidly acting insulins. Coming to the short acting insulins, there are only one short acting insulin is available, that is regular insulin. In the intermediate acting group, we have insulin, zinc suspensions or lente, and neutral protamine hydrotron, NPH insulin, as well as what we use in the clinical practice is insulin mixture, 3070. It is also one of the intermediate acting insulins. And many pre-mixed insulins are available. They are also acts intermediately. Coming to the long-acting group, we have insulin glargine, insulin detemir, and insulin degludec. So insulin mainly used in the treatment of type 1 diabetes, and it is used in treatment of gestational diabetes. They are used in treatment of type 2 when we cannot control blood glucose levels with the oral anti-diabetic drugs. And in emergencies like diabetic ketoacidosis, we use insulin preparations. And in case of surgeries, during surgery tide over, we have to start the patient on insulin. Okay, then coming to the oral anti-diabetic drugs, they're mainly used in the treatment of type 2 diabetes. So the main advantage of this oral anti-diabetic drugs is we can give through orally. The insulin has to be administered through subcutaneous route. So the injection, that is a problem, that is painful for a patient to take. So that whatever the problems or whatever the complication related to the injections can be avoided by giving the drugs through orally. It is more acceptable from the patient point of view, right? Okay. We'll learn about the classification of oral anti-diabetic drugs. We can basically classify them as drugs which enhances the insulin secretion, drugs which overcome the insulin resistance, and miscellaneous anti-diabetic drugs. Coming to the drugs which enhances the insulin secretion, they are also called as insulin secretagogues. They are sulfonylureas, meglitinides, glucagon-like peptide 1 receptor agonist, and dipeptidyl peptidase 4 inhibitors. They are also called DPP4 inhibitors. In the sulfonylureas group, we have two generations of drugs, first generation and second generation. In the first generation, we have tolbutamide and chloropropamide. Nowadays, we are not using first generation sulfonylureas because they produce higher risk of hypoglycemia. However, second generation sulfonylureas are employed in the treatment of type 2 diabetes nowadays. They are glibenclamide, glipizide, gliclazide, and glimepiride. Coming to the second category of the drugs, meglitinides. They are repaglinide, nateglinide. And the third group of drugs, glucagon-like peptide 1 receptor agonist. Even though we have classified them as oral anti-diabetic drugs, but these drugs are injected. They are given through subcutaneous route. So please note down that glucagon-like peptide 1 receptor agonists are administered through subcutaneous route, except for the semaglutide. Semaglutide, we have both injectable as well as oral. So in the category of GLP-1 receptor agonist, we have exenatide, liraglutide, dulaglutide, and albiglutide. And semaglutide, it is a recently approved drug. So we have even oral preparation of that drug, right? DPP4 inhibitors, we have sitagliptin, vildagliptin, saxagliptin, alogliptin, linagliptin, teneligliptin. Coming to the drugs which used to overcome the insulin resistance, we have two kind of drugs for treating insulin resistance. They are biguanide. In that drug name is metformin. Metformin. This is the first line anti-diabetic drug. Okay, we use this as a first anti-diabetic drug unless otherwise contraindicated. Okay. And thiazolidinediones, in that we have pioglitazone and rosiglitazone. Now rosiglitazone is not often used as it is resulted in ischemic heart disease. Okay. Now we are using pioglitazone only in the at possible lower dose for the lesser duration of time. Okay. Miscellaneous anti-diabetic drugs, we have alpha glucosidase inhibitors, which includes acarbose, meglitol, oglibose. In the amylin analog group, we have pramlintide. This drug, pramlintide, can also be used in treatment of type 1 diabetes. This is also the route of administration is subcutaneous injection. Okay. And dopamine, a D2 receptor agonist, that is bromocriptine. The efficacy is not that much good with this drug. Then we have the new group of drugs which are widely employed in the treatment of type 2 diabetes. They are sodium glucose cotransporter inhibitors, SGLT2 inhibitors. The drugs are dapagliflozin, canagliflozin, empagliflozin. Okay. Hope you have understood the drugs which are used in the treatment of diabetes. That is the insulin preparations as well as oral anti-diabetic drugs. Few drugs in the category of oral anti-diabetic drugs like GLP-1 agonist as well as amylin analog is administered through subcutaneous route. Okay, what is the mistake which is done by the students in exam? This is definitely asked as a main question, that is 10 marker for an MBBS students as well as many of the paramedical students. So either they will ask us classification of oral anti-diabetic drugs. what student will do? They will not read that word oral. They will skip this oral word. They will just read classification of anti-diabetic drugs. Can see the second one. So they will try to write the insulin, which is absolutely wrong. If the question asked is classification of oral anti-diabetic drugs, kindly make sure that in the question they have not asked oral anti-diabetic drugs, but only they have asked anti-diabetic drugs. If the question asked is classification of oral anti-diabetic drugs, then you have to write the drugs which enhances the insulin secretion, which overcomes the insulin resistance, and miscellaneous anti-diabetic drugs. If they ask the classification of anti-diabetic drugs, then you can write both insulin preparations as well as the oral anti-diabetic drugs. Again, classification of drugs used in the treatment of diabetes mellitus. You can write both insulin preparations as well as oral anti-diabetic drugs. If the question is treatment of type 1 diabetes mellitus, so please you have to read the question at least thrice before writing an answer, especially for the main questions, right? Because if you miss word oral and if you just write insulin preparations, it carries 0 marks, right? So make sure that question asked and what you are going to write an answer is appropriate to the question asked. And if they ask classification of drugs used in the treatment of type 1 diabetes, again I said type 1 we are using only insulin preparations. Even pramlintide is approved, but the mainstay of treatment for treating type 1 diabetes is our insulin preparations. So if they ask either type 1 diabetes or insulin preparations, your answer should include the classification of insulin preparations. If they ask oral anti-diabetic drugs, you have to write the drug names which are acting, which drugs enhances the insulin secretion, which drugs enhances the insulin, decreases the insulin resistance, and other drugs, whatever I have told. Okay, so make sure that the question is having oral or it doesn't have oral or it is used for treating type 1. These things you should keep in mind while writing an answer for this question. Hope this will help you all. Thank you.